Okay. Rena, can you introduce yourself and also all the amazing work that you do and have done?
Yes, thank you very much, Giu, for this wonderful night. So first of all, I would like to thank you, the Checkpoint and all the organizer for having made this event possible. So it's my great opportunity to be part of this activity tonight. So my name's Rena Chen Amnoi Suk. I'm from Bangkok, Thailand. I'm also a transgender woman. And right now I'm working at the Institute of HIV Research and Innovation, or IHRI, based in Bangkok, Thailand. And I'm also running the first transgender-led clinic in the region called the Tangerine Clinic. And in addition to that, I'm also co-founded the first transgender-led human rights-based organizations in Thailand called the Transgender Alliance for Human Rights. Yes, and thank you very much for having me. Thank you.
And in question of cooperation with other also health clinics or organizations, how do you cooperate and how is it in Thailand or also Asia-wide? How do you manage this?
Yes, first of all, before we established the Tangerine Clinic to become the first transgender-led clinic, I would say that at that time, my boss, she's a medical doctor, and she found that there was none of transgender people coming for HIV testing at all. After she's and her father's running a sexual health clinic for 20 years. So it's maybe coming for two main reasons. The first one is about the data collection, that in Thailand we cannot disaggregate the gender identity or the sexual orientations to capture the data for transgender populations in the country. Many of you may have perceived that Thailand is a paradise for LGBT people, especially trans, right? But in reality, it's not true. I would say as a Thai citizen, as a trans woman, we still don't have gender recognition law. I just shared this with the Checkpoint colleagues this afternoon. My passport, even now, including my national identity card, still using my sex assigned at birth. And it put me I was very scared every time when I travel overseas. Even right now, I carry it with me. It still used Mr. and sex as male. So it's already discriminatory practices against the transgender communities in Thailand. So I think it's about the data collection that might not be appropriate capture. And the second reason is about stigma and discrimination associated with HIV. Because we cannot hear or we cannot listen to HIV all the time. As a transgender individuals, we have other unmet health needs. And one of the most prioritizing health needs is gender-affirming care. And I also organized the first transgender community consultation in 2015. And we asked them why they did not come for HIV testing. So they said two things. The first thing is they did not prioritize HIV and sexual health services. And the second is about stigma associated with HIV. And we asked them the next question: what should we do to better improve access to healthcare services among trans people in Thailand? They said the first thing that they want to see is to have a trans person, the visibility of the trans people at the clinic. And second, the clinic should be a dedicated or private space separately from other populations. And we asked them the next question: what should be the services that you always prioritize? So it's in line with what we thought is about gender-affirming care and hormone treatment, including hormone treatment. So that's when we organized that community consultation, and we invited different trans people coming from diverse backgrounds, like transgender sex worker, trans women, trans masculine people, transgender youth, transgender sex workers, as well as transgender celebrities. And at that meeting, it was the origination of the Tangerine Clinic. Even the name of the clinic. When you ask me, oh, why Tangerine? Because at that time, the word transgender was a new thing. It was Western concept, right? Coming to Thailand. And we don't have the appropriate translation for the terms transgender. So we use the word tangerine because it was not too masculine or too feminine. So all trans and non-binary people can access to healthcare services. And on that day, we agree to go for the Tangerine name. So you might be wondering, oh, were the other names? So it's coming like Beyond, Wings, or something like many names that were nominated. But finally, the Tangerine was agreed upon and reached to the consensus. Yes.
Okay, so the Tangerine Clinic was very much founded with taking into consideration a lot of different trans people with different backgrounds then.
Yeah.
And in regards to health insurance, how does it work with you with the costs for gender-affirming care, like hormone treatment or also STI checkups and stuff like that?
Yes, for HIV and other sexual health services, right now we can get it supported under the healthcare insurance, which they have a few like 3 main different healthcare schemes, which you can reimburse from the government. However, in terms of gender affirming care, the trans people in Thailand, we are not entitled to get these supported under the healthcare insurance. So, which means that all of hormones or surgery or any other gender affirming care procedures, it has to be out of our trans pockets. So you might have understood that, oh, Thailand might be able to reimburse or cover the healthcare insurance for gender affirming care, but in reality, not. Even my gender affirmation hormone treatment, I still have to pay out of my own pockets. And can you imagine what's happening with the young trans people who wanted to seek, hormone treatment, and they cannot go for healthcare services or to the hospital where they provide gender affirmation. They are they instead like access to hormones from the black market or from their senior peers. And my first hormone tablets in my life when I was in high school was from my mother, like senior friends in the school. Yeah, and I took 7 tablets in one day without knowing that the side effect would cause my body, or is there any negative effect to my health in the long run. Yes.
And in the Tangerine Clinic, in regards to harm reduction, how do you proceed? So what are different procedures that you do, like as you said this afternoon, with paying forward or also with the testings and how do you do the harm reduction?
Right now, the services at the Tangerine Clinic, I would say there are 3 schemes of funding that we get supported. The first one is coming from the National Health Security Office, mainly about HIV testing, PrEP, STI screening and testing, as well as ARV for those living with HIV. And the second, it's about gender affirming care. Right now, we are receiving from the US government, which is the USAID, United States Agency for International Development, but they're also supporting only counseling and hormone level monitoring, which is the laboratory testing course, which the US government has been supporting right now. And the rest, the hormone itself, the surgical treatment, surgical care, it has to be out of the client's pocket. So it's coming from 3 different schemes. And for those who cannot afford, my clinic have a small fund called Pay It Forward. We actually got the contribution or the donation from the clients who are willing to help their peers if they cannot pay for the services, and including harm reduction or mental health care services. So we have this kind of small fund to help those in needs. Yes.
Thank you very much. And also in terms of harm reductions, we talked previously also about transmasculine people. And how is this in your clinic? Do you focus on trans women, trans feminine people?
Yes, I would say in Thailand, the pictures of the trans communities are focusing mainly on trans feminine spectrum, right? And in my clinic, we are running the clinic for 7 years now, and we are able to serve to more than 6,000 of the transgender individuals. However, 95% of them are trans feminine or trans women, and the remaining are, I would say, they are trans masculine or trans men. Yes.
Okay, thank you very much. And also for trans women, trans feminine people, the new vagina care you have, which we don't have at the checkpoint, which is very exciting for us. You have actually something installed for new vagina care. Can you elaborate more on that?
Yes, I think the reason why we have integrated neo-vagina care for trans women, because we, from the clinic data, we found that 22% of them, among like 6,000, they have undergone genital surgery for trans women, and which means they have neo-vagina. And the challenge that we found from these from those who have undergone genital surgery was that when they have undergone the surgical treatment, right, the genital surgery, there won't be any follow-up care or post-operative care provided to these communities. And maybe it's provide like once or twice, and then you can go. But after that, our trans client, even they didn't even know how to provide or how to look after their neo-vagina appropriately. I have a case of a trans woman. She had neo-vagina for 5 years, and she came to my clinic, and she said she has discharge from her neo-vagina. And my doctor, she's a gynecologist, he used the high resolution scopy, looking at other STIs, other sexually transmitted infections, and inside of her neo-vagina, and he found some discharge and some of the condoms parts left in her vagina. And she told the counselor that she did not have any sexual intercourse for 2 years. So which means that all of the condoms particles has been left in her neo-vagina for 2 years at least. So I think it was something that we need to think about. How are we going to provide the services or specific services that our transgender community cannot access to anywhere. And we also found some STI related to neo-vagina among the trans women community as well. Yeah.
Thank you. And also in regard to the gynecologist that is working with you, he has a lot of experience and knowledge, which also in Switzerland cannot be found in many medical providers. Do you also have kind of a school or a schooling, yeah, or a courses, yeah, for other healthcare providers who are interested?
Yes, actually we have created a technical assistant platform called the Tangerine Academy for Transgender Health, where we actually, when we opened the Tangerine Clinic 3 years, we received lots of interest coming from other countries in the region that they wanted to establish a transgender-led clinic like the Tangerine Clinic. And they came and they learned from us, they stay with us, but unofficially. But after that, my boss, she's a medical doctor, she said like we should do something to be more tangible in order to institutionalize the training or to develop a training curriculum. And then I think the 4th year of the Tangerine Clinic, we developed a technical assistant platform called the Tangerine Academy, where healthcare providers, community representatives, or even policymakers, they can come and learn from us. And mostly the training will be provided by 2 healthcare providers and community health workers. And the courses last 1 week to 2 weeks, depending on your area of interest, including your HIV testing, gain frame counseling, gender-affirming care, neo-vagina care. And it's not only including on lectures, but we also providing didactic trainings, case studies, case conference, and clinic observation. As well as at the end of the course, you have to pass the examination in order to get the certificate. And the certificate has been endorsed by the Faculty of Medicine, Chulalongkorn University, where we have established a close collaboration with them in the past 7 years. Yes.
Thank you very much. And in the Tangerine Clinic, how many people work there, in which functions? And also, what does it all entail, the Tangerine Clinic?
Okay, so right now I can say that there are 12 staff working at the Tangerine Clinic, and all of them are trans-identified persons. They're mainly trans women, including myself. We have transgender program manager, transgender supervisors, transgender peer counselors. We have 4 transgender peer counselors, transgender nurse, and transgender doctors. But we also working with cisgender, healthcare professionals, healthcare team as well. But I think specifically for Tangerine Clinic is a trans-led organizations. Yes.
And looking at your background, you also did a lot of research.
Yes.
Are you able to do that also in your clinic, and how do you do that?
Yes, I think we actually did lots of research among trans people, and I think the one that we found very impactful during the COVID-19 was about self-sampling collection, which Checkpoint is also doing, right? Because in most Asian countries, also in Thailand, people are very shy to open their private parts to the healthcare providers. And when we introduce testing for chlamydia and gonorrhea, the uptake of these services was very low. And we asked our transgender clients, why you did not want to test? And she said, oh, mom, I wanted to test, but I'm so shy. I was embarrassed to open my private parts to the doctor. And it's maybe coming from trust or something like that. But during the COVID-19 came, we wanted to maintain the social distancing between clients and healthcare providers. So we introduced the self-sampling collection for chlamydia and gonorrhea. And the specimen will be collected through 4 anatomical sites, including oropharynx, urine, and neovaginas for those who have undergone genital surgery, and also rectum. And unbelievably, we found the high prevalence of chlamydia and gonorrhea among trans women. It was almost 40%, 40, and all of them were asymptomatics, right? When we offered them, they said, oh, I don't have any symptom, I don't want to test. But when we introduced this self-sampling collection, I think it was very helpful for them to be able to control their own health. It's another empowering tool for them. Yes.
Thank you. I think also a very big contributing factor in your trans-led health clinic is also not to have fear of discrimination, because you yourself, a lot of from you in the team are yourself trans. So that opens also up the opportunity that they come and don't have the fear.
Yes. I think before we opened the clinic, we actually did a stigma audit. It means the process where we have to foresee if there's any potential stigma or discrimination may happen, even at the every point of the clinic. Even we found that, the potential stigma can happen even at the security guards level. Because sometimes our security guards, they were over complimenting, to the trans women, especially, and also the receptionist. They have to receive the gender sensitization training, and in order to make sure that they collect the appropriate data, gender identity, sexual orientation, as well as preferred names and preferred pronouns. But in Thailand, we actually don't have gender-specific pronouns, so we have gender-neutral pronoun. So it's maybe easier for the Thai people to call by using the gender neutral pronoun. But in terms of name, you know, your first name, you can choose what you wanted, because sometimes you cannot change your first name in your national identity cards. So it is kind of another entry point that can facilitate the access for the community to healthcare services. And it's also, we also conducted the gender sensitization training for all healthcare providers, including laboratory, the lab technician who going to do blood draw, or if they want to confirm the right information of the clients that they have to draw blood as well. So it's right now it's become the mandatory policy. If we have any new staff recruited for any position at this organization, you have to pass the gender sensitization training. Yes.
Very interesting. And did you build this this course yourself or with your staff together? This anti-discriminatory training?
Yes. Actually, it's very interesting. We invited some of the transgender clients, and we asked them what can be do's and don'ts when receiving care, and we listed all of the do's and don'ts when they're coming to use the services, and we develop this. It becomes online right now on the website of my organization. We call Trans Health 101. I think it's similar to the Western curriculum as well, but it's going to be more local specific settings for the Thai culture, because Thai people, like, they have specific words when you may not have intention to stigmatize or to discriminate, but I think it's coming, sometimes they did not know how to communicate or how to interact with the trans people appropriately. Yes, like, oh, you look like a woman. Sometimes like they thought like, oh, it's a compliment, but when we ask, the healthcare providers thought like it's a compliment, it's positive, right? They wanted to entry or to begin the conversation. However, when we asked the trans communities, they said, no, you look like a woman mean I'm not a woman, right? Or something like that. So this is the just like the practical sentence that we share with healthcare providers. And they said, oh, I didn't know that. I didn't have bad intention to stigma or to hurt them. So we just developed what kind of sentences or word that the transgender community did not want to hear. Yes.
I think it's very admiring and also very, for me, aspiring to see that every decision that you do in the clinic, you do including the community. Because, yeah, you also explained with the name, you also invited the community. Yes. And also, in that step, you also included the community. This is very. So you are also very close with the activism part.
Yes, I think when we let the community lead, I think it's gonna be very easy for us to do something. If you want to end the HIV or end the AIDS epidemic, you have to engage the community, or you have to involve or let them lead, because this is their response, right? And again, it's the Tangerine Clinic cannot access or cannot reach to the community if they are not coming from the community. Even right now at the promotional materials or educational materials used at the Tangerine Clinics, we use the photos or the statements coming from the transgender clients. And we don't have the traditional outreach team to go to to reach out to the community in person or physically, but we actually worked through online platforms, and we work with different transgender social influencers. And at first it was a bit difficult because they did not want to come to use the services with us. But after that, we tried many times, and then when they came, they believe in our service quality, they believe in privacy and confidentiality. They help us promote the clinic from their own words, and it's really increasing, number of the transgender clients to use the services at the clinic right now. Yeah.
And you also talked about the peer counseling, and with us, especially with very young people and adolescents, in peer counselings, a lot of times also the parent kind of
Yes.
needs guidance and a peer counseling. Do you also provide that at your facility?
Yes, I would say that one of the most how can I say, important element or successful factors that contributed to the Tangerine Clinic achievement is about the peer counselors, because they are transgender people and they have lived experience. And I think this is one of the strengths that they are willing to share with the transgender clients when they don't know where to go. And I would say that the youngest trans individual who came to my clinic was 12 years old, and the eldest one, the senior one, the most senior one was 77 years old. For the youngest one, she knew about my clinic from the transgender social media influencers, and she came with her mother. And her primary purpose of the clinic visit was about to initiate hormone treatment. However, when she came to meet with our transgender counselor, she shared with my counselors that she was sexually coerced when she was in school, and this happened with her for 2 years. And we asked about this information while her mother's outside, because in Thailand you can offer HIV testing to anyone regardless of the age. So which means that HIV testing can be offered to the children as well, if the counselors assess their risk behavior, their eligibility criteria, and she agreed to accept HIV testing. And the testing result was, and she was diagnosed with HIV on that day, which she was not ready, because her primary purpose was about gender-affirming care. Can you imagine that if we did not provide gender-affirming care, she wouldn't come for HIV testing? But we were very fortunate that she was willing to share this with her mother. And we had to educate her mother about like early treatment, same day antiretroviral treatment initiation. And she doesn't need to choose, she doesn't need to prioritize between hormones or ARVs, but she can take both, and in order to suppress her viral load and to ensure her gender affirmation. And I think this is another way that we providing care not only for the trans themselves but also their family members. And I think 3 or 6 months later, she came back with her mother with a big bag of snacks for our staff. So it's a small thing, but we found it very heartwarming for me. And another case is the eldest, the senior one. She's 77. She came with us, and we asked her to we stigmatized her, no? We thought like, oh, she's 77, she wouldn't be like sexually active. She would come for gender affirmation or even neo-vagina care, but she said, I wanted to get PrEP. But she still, So I think like it's another way that we have to make sure that our services are inclusive, and we have to tailor our services to the specific needs of the population that we serving individually. Yeah.
Those are also very big examples of how you managed very well to do harm reduction, which is very impressive in regards that you were so inclusive and also non-judgmental, that was possible.
Yeah.
And in regards to the future for your clinic, but also maybe in the next step for us, what do you suggest? What do you vision? What is your hope?
Before I answer your that question, I have another thing to add, because right now we in terms of harm reduction, we know that trans people in Thailand, especially from my community, they normally share syringe and needles. It's not only for injectable hormones, but for any like Botox or silicone injection. And so that's why it's a way for us to ensure that they can access to safe injectable equipment. So right now, my clinic, we are offering Botox and skincare as part of a strategy to bring them. If you want to inject, come to us. We're gonna inject for you, and the cost is affordable. It's not like the cosmetic clinic, but we can do it. We have a plastic surgeon coming once or twice a month to do Botox for you. And while you're waiting, you can do HIV testing. You can do self-sampling collection for chlamydia and gonorrhea, or even you can talk with our psychiatrist, because we have a psychiatrist coming to provide mental health care support and medications to our clients as well. And to your question, Jill, I think I wanted, because I'm coming from the middle income countries, right? And we have limited or lacking of physicians or medical doctors that they have to work, because they have to work around the clock in Thailand or in other countries. So we thought that a community-led service approach is a way to go. And it's another way to do task shifting or task sharing. Can you imagine if we, in terms of mental health right now, we use the peer counselor to provide mental health care services. If we ask the psychiatrist to screen for mental health condition for every client, can you imagine that how much work that he or she would be having, right? But right now the model is that we train the transgender peer counselors to be able to provide depression and anxiety as well as post-traumatic stress disorder screening. And if the scores, or if our clients detected having mild depressive symptoms, for example, our peer counselor are able to provide some certain level of the intervention. It's another level of care. But if it's beyond the expertise, or if that clients require further diagnosis, we're going to refer our clients to meet with the psychiatrist. And it's very successful right now. We use a peer-led depression screening. And we are able to identify those who have depressive symptoms, those who endorse suicidal items in the screening questionnaire as well. So it's not only the sexual health, right now it's about the mental health, psychological health, and communities, families, partners, relationship. They came for HIV testing. One cisgender man coming with a trans woman for HIV testing. But it turns out that a trans woman was diagnosed with HIV. Can you imagine? It's like witch hunting. Like, oh, you probably betray me, or you probably cheated on me. So I think it's a kind of relationship management that we have to provide this kind of support to the couple when we provide sexual health services as well. Yeah.
Thank you. And we, in this afternoon, we talked a lot about, of course, your clinic and also the Checkpoint you came to visit. Do you also have recommendations for the community in Switzerland, or also the trans healthcare system in Switzerland? What to improve? You don't have to answer, but I would be very interested.
First thing, the Checkpoint staff asked me to move to Switzerland because I can change my gender marker, right? I can get my gender-affirming care supported or insured, right? Because in Thailand, we do not have gender recognition law. We don't have health insurance for gender-affirming care. So don't go to Thailand. It's not the paradise anymore. Yeah, so I would say that you are doing a good things already at Checkpoint, because I think when I first stepped into your place, I found it's quite similar to what I've been doing in Bangkok. However, the majority of the population that I'm serving is the trans and non-binary population, but we're also having, lesbian, gay, men who have sex with men, cisgender women coming for sexual health services as well. But I think you are doing good thing already. But the principle that I have learned from running a Tangerine Clinic is integrated care, is needed, especially at the primary care settings, because we can prove that we can increase access, we can facilitate those who are vulnerable to HIV or to other healthcare services access to these services. And another thing is that You have to let the community lead. It doesn't mean that, the cisgender community or we are not trans people, we are not going to lead. But I think we have to work together. In Thailand, the clinic cannot be successful if we don't have support from the cisgender community. Even my boss, Dr. Nitaya, she's a cisgender woman, but she just let the transgender community make a decision and come back with data. Because all of this data, we have to do it for policy change. Right now, we are advocating for policy change to include gender-affirming care as part of the national healthcare services. And we are using this data from the Tangerine Clinic to push for the gender recognition law. Yes, so it's evidence-based information.
Mm-hmm. Yes, I think for me, a few big take-home messages are for sure how you do research, and also how you are how you do trans-led care. I think this is a very big take-home message for me, and also the new vagina care, because this is in Switzerland still very much not there. But also I think how you do the courses for other healthcare providers on that scale that you do it. I think this is very, very impressive, and especially thinking about also how difficult it is everywhere to get funding for that matter. Yeah. So I think that's a very big win that you have there.
Thank you. And another thing I would like to say is about the community-led health service approach can be replicated to other populations. Right now, we not only having the Tangerine Clinic, but we have other community-led clinics or organization run by a community of gay men, a community of sex workers, or even a community of migrant workers as well. So it can be translated to other populations and replicated by in other settings as well. Yeah.
And also for research, what are your next projects? That would be also interesting.
Oh, we have loads. We also receiving the funding support from Gilead right now to conduct a study on drug interaction between gender-affirming care, hormone treatment with PrEP, FTAF. We did the one 5 years ago between TDF, FTC, and feminizing hormone. But this year we did FTAF with feminizing hormone, and another population, trans masculine people with masculinizing hormones. And we have the preliminary data presented at the International AIDS Society conference in Brisbane 2 or 3 months ago, but we gonna right now we analyzing the data on tissues as well in order to see if there's any drug level enough in order to prevent HIV, and from PBMC as well. Yeah, so I think this data will be helpful for the WHO guidelines on PrEP, whether or not they're going to recommend FTAF to be taken in the same time while on gender-affirming care. Yes.
I will look forward to read that. Yes. Okay, now I think do you want to say something?
I think it's time for...
Yeah,
maybe it's time for me to ask them back.
Yes. Do you have any questions in the audience? Yeah.
Thank you very, very much, Rena, for sharing all of this. I just want to also say that I'm very impressed by everything you do, and one big thing was also very impressed by how much you include the community. That's very, very inspiring. One question I have is maybe how much of a topic sexualized drug use is in your clinic, and if is that a topic, and if so, how do you handle it at the clinic?
Thank you very much for your question. I think I did not answer the question raised by Giu before. Based on our data at the clinic, 10% of the clinic populations reported using amphetamine type stimulants, 10% out of 6,000, and it's self-reported questionnaire. Can you imagine that is the number may be higher? However, we did nothing, because I think right now before we thought that sending them to rehabilitation centers is the solution, but we were wrong. And we did not know how to, we just learned that, it's not only referring them, or it's not only providing them sterile injecting equipment, right? But it's about legal support, social support, mental health support, and all of this support that we are trying to develop or to come up as a comprehensive package for harm reduction, specifically for trans women. But right now I'm collecting the data by conducting a qualitative study from these women, from those who use it, currently using it, for those who formerly use it. We wanted to know why they stopped using it, and from their partners, as well as from their families, as well as from the healthcare providers' perspective, in order to assess their readiness to provide these harm reduction services. And I would say that the substance use culture between gay men and trans women are not the same, and there might be something related to coping strategies, mental health, family rejection, sex work. It might be overlapping, but there might be some other distinct factors that we wanted to understand more. And hopefully, maybe early next year, we can come up with a comprehensive healthcare service for harm reduction. Yes, thank you very much.
Thank you very much for this very inspiring talk. You said that the cost of hormones and operations is not covered, they have to pay out of pocket. How do you keep the prices low? Do you have deals for hormones? And how do you keep people from going on the black market or to operators that are not qualified for these operations?
Yes, I would say that the hormones is available everywhere in Thailand, over the counter especially, and also from online or from black markets. But we use the strategies that you can use hormones anywhere. You can believe in any hormones brands that you are using. But when you come to the Tangerine Clinic, your hormone level monitoring will tell the true result. Because, for example, like this transgender community, they're using a brand and they believe that, it's going to transition them very rapidly, and they're gonna look more feminizing in one day, something like that, and your shoulder will be narrowed down, which is not true, right? But this is the just like marketing strategies. So we ask them, whether or not whatever you use, come to us for free testing, and then the blood result will tell. And that way we use the strategy to change their behavior or that attitude to come to use the recommended hormone medications. And the price is not expensive. It's just a few hundred baht a month. 200 baht a month means, I don't know how much in Swiss franc.
It's like 10 francs a month.
No, it's less than that. Cheaper than that, yeah. Because I paid for Thai food in Bern, it was very expensive. So, oh my God. Try Thai green curry, it's like, 50 baht in Thailand, in Bangkok. And in Bern, it was 50 Swiss franc. Oh my, 55 actually. Yeah, so, and for the surgery, this is unfortunate. It depends on which plastic surgeon that you wanted to go. But when we cannot do the genital surgery at the clinic. The only thing that we can do is minor gender-affirming surgery. We can do eyelids, we can do rhinoplasty, we can do nipple revision and neo-vagina touch-up or something like that. But for those who wish to have genital surgery, we refer our clients to Chulalongkorn University Hospital, which is a public and teaching university hospital. So the price is affordable. I can say I don't say it's cheap, because my clients will be, oh, cheap, I don't go, I don't want to go, but affordable. But the problem is the queue, is the long waiting period was very, 1 year, 2 years, 3 years, it depends. But if our clients can afford, they can go to other hospital, private clinics, private hospital. It depends on how much money do they have. But you have to admit that lots of young trans people, they have to engage in sex work in order to save, to earn their incomes, in order to process for genital surgery. That is not a good way, right? But it's the reality right now in my country. Yeah.
I'm allowing myself to ask a second question about PrEP uptake. So we know from studies that transgender women are actually very good with PrEP adherence.
Very good?
Yeah.
It's not good at my clinic.
So yeah, that was my question. How is the PrEP uptake and adherence at your clinic, and what are your strategies to motivate these transgender women to go on PrEP?
Yes, PrEP uptake at my clinic was around 30%, 30. It was impressive for me already. Before that, it was less than 10%. And if you knew drug interaction between gender-affirming hormone and PrEP was one of their concerns. And another thing is stigma associated with PrEP. Because in Thailand, if you use PrEP, it means you don't use condoms. So condomless sex has been devalued by most of healthcare providers, especially in public healthcare settings, because they did not support PrEP, I can tell. And another thing is that if you want to get free PrEP, you have to go to your hospital where your health scheme has been registered. It means that if I live in Bangkok, but my healthcare scheme has been registered in Pattaya, I have to travel all the way 2 hours from Bangkok to Pattaya to get free PrEP. We're going to get it for free. But in reality, no, right? So we have to pay. But a willingness or ability to pay for PrEP, I think was very low among the transgender communities in Thailand. So what we did was we encouraged the Ministry of Public Health to launch the first transgender specific campaign called PrEP in the City, because we wanted to be visible. If you are the same age, right? Sex in the city, right? So we use the same thing, but we use 4 different characters of trans women sharing their story about PrEP use. And the campaign was denied by the Ministry of Public Health at first, because there's lots of senior policy makers. They thought that if you advertise PrEP campaign for trans people, you're going to encourage condomless sex, and you're going to promote transgender people in the wider communities. I have to make a justification letter for 10 pages to make this campaign out in the public. And we observed PrEP uptake, increased PrEP uptake, as well as we change the counseling techniques. We call it gain frame counseling tools, because originally, if you are eligible for PrEP, you should have these criteria. For example, multiple sexual partners, you have to engage in sex work, you should have STI history, or you did not use condoms, or you use substance or chemsex, then you will be eligible to get PrEP. But we did that without knowing that this kind of question is really stigmatizing our population. If you ask me this kind of question, I would say no, right? So we changed the counseling techniques to make sure that our clients has their informed decision about whether or not PrEP is right for them. Yeah, and we have seen gradually increase of PrEP uptake among the communities at my clinic. Yeah.
I have a question regarding that. You said that you changed your counseling technique.
Yes.
Did you write a concept for it?
Yes.
Because
We developed a training curriculum,
wow.
and we translated into English already.
Oh wow, okay, interesting. I will come
not
to
in
you.
German or French, yeah.
Yeah,
But I
okay.
think that in English, because we use this as part of the training course for the healthcare providers, because they wanted to see to learn how we can increase PrEP uptake among the communities and how they can go back home, use this similar concept and translate it into their own language. Like they can translate into Filipinos, in Bahasa Indonesian, or in Burmese, and they can test it before and after. They launched this gain frame counseling technique we call gain framing. We don't use lost frame. Before, like, oh, if you don't use PrEP, you're gonna get HIV. This is lost framing, right? You scare them. But you're going to have a better sexual pleasure if you go for PrEP. Something like that. We just change our attitudes. Yeah, and then we just deliver this to our clients.
Interesting. I will come back to you about this. Any more questions?
First of all, thank you for all your work as well from my side. I wanted to ask, if you reach your clients, how do they come in? Is this all based on a walk-in strategy, or do they have appointments? And if they have appointments, how do you get them to come in to the appointments?
Yes, I think we use the similar things like what Checkpoint's doing, because I saw one of the clients came and they press on the button on the tablets, right? And the appointment view shows we actually use our social influencers through different platforms. If we want to reach to sex worker communities, trans sex worker community, we use Twitter or X right now. And each of them will have their token link, and they're gonna post it on their account. And if their followers interested in booking these services from this social influencer, they will press the button and it will be linked through the appointment system directly. And all of the social influencers who followers book their online from their token link, they will get the incentives, 100 baht per person if they come to the clinic, if they show up at the clinic. So they should find a way to encourage their followers to come to use the services. And when they come to the clinic, they're gonna have their online appointment slot already. They just press their button and they can enter their personal data on their tablets, their kiosk. And if they want the services to be supported by the government or by the country, by the national healthcare system, they have to insert their ID cards. So the card will read their national ID number and it will link to the free HIV testing, free PrEP, free ARV, for example. But if they wish to remain anonymous, they can also, they can choose not to give us the national ID cards, but they have to pay for their services. Yeah.
Any more questions?
Also from my side, thank you very much for being here. I wanted to know, do you have an explanation or a clue why there are just 5% of transmasculine clients at your Tangerine Clinic?
Yes, I think this is how can I say, is the challenges that we had during the first 2 or 3 years of opening the clinic, because we were asked to stop providing the services to trans men, because at that time the donor, I don't say no which donor, the donor told us that the Thailand's HIV program should focus on trans women only, because of the data show that at that time the HIV prevalence among trans women was 20%, and they did not have any data on trans men. And they thought that, oh, trans men might not be susceptible to HIV acquisition. So we just promoted it for trans men as well. but we have to ask them, we have to ask them to pay for the services, or we have to refer them to another hospital where we help them establish a gender health clinic, where we refer like trans men to go to that hospital, but it's in a walking distance. So 2 or 3 years later, the donors' vision or mission changed. They said, now you can provide services to trans men, because they found the study in the US, especially in San Francisco, the HIV prevalence among trans masculine people was very high, especially among trans men who engage in sex work. So that they asked us to, open the services for trans men. And right now we have around, 5% of trans masculine and trans men people, but none of them diagnosed with HIV. It means that, maybe we are not doing good enough. All the clinic staff are trans feminine or trans women people, even myself. So I did not understand well about this community. So we are not doing good enough. And this year, I think this physical year, from October onward, we are working we employing another trans man and another non-binary staff in order to ensure that we understand the needs of the communities. Yeah. Hopefully next year I can have more data to share with you.
Thank you.
No questions left then? Okay. Yeah, special thanks to you, Rena. It was very, very interesting. And it was really an honor to speak with you here and also all this afternoon. Thank you. And also thank you to the audience for coming.
Yeah, thank you.